This control room, just outside Norwich, is the nerve centre for the East Anglian Ambulance Service. Covering the 3 counties of Norfolk, Suffolk and Cambridgeshire, the centre receives an average of 18,000 emergency calls every month.
Just currently trying to contact the lay responders.
State-of-the-art communications mean that as soon as a 999 call comes in, an emergency ambulance is sent out. Ambulance technician Jean Reynolds has just received a Category A red call. It means she has just 7 minutes to reach the patient.
We're actually called straight away and told to run red to whatever area. Then our job comes on our machinery in the front of the vehicle, the Terrafix, and it tells us where we're actually going to go, which gets updated as we go along. And then obviously when we get nearer this situation, we should hopefully know then what we're dealing with.
Also on board, paramedic team leader Peter Simpson.
We're going to a lady with breathing difficulties, but quite often all you ever find out prior to getting to a call is you're going to someone who's got breathing difficulties or chest pain, or they've taken a fall, or you're going to a road accident or an overdose. And we always take our response bag and our kit here, take that to every single call, and then you don't get caught out. So it should be just here, Jean.
The patient had made her own way to the doctor's surgery, from where help was immediately summoned. The combined skills of the crew, together with the facilities on board the ambulance, mean that in the majority of cases a patient's condition can be stabilised at the scene, or at least well before they arrive at hospital.
Blue light runs back to the hospital are actually very rare. The word ambulance is a French word for mobile hospital, and once the ambulance arrives on scene, technically the emergency is over. Is something cold coming up your arm? 50% of all the calls that we go to, we never transport the people to hospital at all. We arrange their care at home.
All ready to move, Peter?
Yep, fine.
Peter and Jean are based at Cromer Ambulance Station, covering North East Norfolk, but as the nearest A&E is 25 miles away at the Norfolk and Norwich University Hospital, much of their time is spent on the road.
Vivian's underlying heart rate is around 28, which is causing her blood pressure to fall, which is why Vivian experiences periods of lightheadedness when she stands up. So you're much happier, I guess, sitting down and laying down.
However unpleasant Vivian's symptoms, Peter's prognosis for her is good.
With patients with palpitations, and in her case she had episodes of irregular ventricular contractions, most of the time they can be treated with medication, so she should make a good recovery.
The next call is to another patient struggling to breathe.
We've been called out by a GP to an elderly female breathless in heart failure in Norwich. So our running time is probably about 6-7 minutes to this. Should be a doctor on scene.
Peter's thoughts are now firmly focused on the patient's immediate needs.
I need to get feedback from control. I need to know, if it's possible, the age of the patients. I'm also thinking about how far we are to hospital and what treatments are going to be relevant to the patient. Hello, ambulance. Now, the oxygen's just going to help you breathing. I just need to have a little listen to your chest. Yes. Are you being treated for a chest infection at the moment?
No.
Oh, okay.
Olive's condition, known as left ventricular failure, is well known to Peter.
Basically what's happened is you've got fluid is accumulated in your lungs, which is causing you to be this breathless. Okay, so we need to shift the fluid. A lot of the times these patients present very, very poorly, very, very breathless and desperately scared. Their lungs have filled up with fluid and they just feel like they can't breathe. Now the treatment we can give is life-saving at the time.
As Peter starts the procedure known as cannulation, designed to take fluid off the lungs, Olive distracts herself by singing.
All things wise and wonderful, the Lord God made them all. He gave us eyes to see them.
With regard to the singing, I'd never seen that before in my entire career, and I've been doing this for 20 years, but she was so scared, bless her, of having the needle put into the vein, and yes, it does hurt sometimes. And she just sung, and she sang her way through it, and beautifully.
It's time now to transfer Olive to the ambulance.
Okay. Pop a little finger in there for me. Good girl. Right, just rest it there. Okay. Don't get upset. Because I need you to concentrate on your breathing, yeah? How does your breathing feel? Still a bit?
It's a bit easier now, thank you.
Yeah, so it takes about 20 minutes for the stuff to work.
Yes.
Okay. Well, we've been running a nebuliser mask with 5 milligrams of Ventolin to basically open up Olive's airways so that she can get more oxygen in, because at the moment her airways are full of fluid, so we need to open up the airways. But the nebuliser's nearly run out, so we're going to change off that nebuliser mask just on a 28% oxygen mask. But your breathing seems a little easier now, and you can talk, which is lovely.
I'm talking, aren't I?
You're talking, yeah.
I can talk before.
You haven't stopped.
Oh, we're nearly there.
We are nearly there.
Oh my goodness, I can't go. I don't want to go. I don't want to go.
Now, the worst thing that can happen here, yeah, is that you get upset.
Thanks to the actions of the paramedics, Olive was breathing normally, and despite her anxiety, she spent only a few days in hospital before returning home. Another emergency call, this time to a woman taken ill on a bus.
The person who's fitting, through experience, usually by the time we arrive, they've usually stopped fitting, as a rule. Things that can cause fit is most likely probably epilepsy. Another reason that people could fit is actually a cardiac arrest. If you should have a cardiac arrest, no blood's pumped to the brain, your heart stops beating, and the patient starts to fit. And the advice ought to be then that the public should start CPR.
CPR, or cardiopulmonary resuscitation, is a combination of mouth-to-mouth resuscitation and heart massage. It's a technique which Peter thinks everyone should learn.
Back in October 2003, I went to a gentleman who'd suffered a cardiac arrest outside of a school. Now, he was the 10th patient I'd been to that month who had actually died from cardiac arrest. The difference for this gentleman was he had died in front of 200 lifesavers. The children who came out of school didn't know how to do CPR. And I just found that absolutely shocking, that the children had learned all these things in school, but not how to save somebody's life. And that really stuck with me, to the point where I did a lot of research, raised a lot of money, and went to America. And in America, we found in Seattle that 43% of people suffering from a cardiac arrest survive.
Yeah, we are.
Because in Seattle, they teach the school children, have been teaching school children for 30 years, how to do basic life support. Our survival rate in England from cardiac arrest is 2%, where in Seattle it's 43%. That's a monumental difference.
Inspired by what he'd seen in Seattle, Peter, together with Jean, set up Heart Start.
It is our goal to make sure that every child in our county, Norfolk, receives basic life support training. It's a 10-year programme. It's going to take 10 years to get every child taught, but that's my ultimate goal, my 10-year goal at the moment. You've not hurt yourself.
But there's no need for CPR on this occasion. The patient had suffered an epileptic seizure.
All her vital signs and all her obs are normal, and so my paramedic colleague on the bike is going to give her another once over just to check again that she's okay, and then she's going to make her way home.
It's now late afternoon. Peter and Jean are on another emergency red call.
Peter was a technician before he became a paramedic, but he has more skills now. He can obviously intubate and cannulate and give more drugs. My role is to support him, which I'm quite happy to do so. We get on very well, we always have done. We just gel, basically. If I say the job is fun, it sounds as if we're not working hard, but we work hard, but we enjoy what we do.
The patient is reported to be vomiting blood.
People get confused with vomiting blood because they get it confused with actually coughing up blood. If someone coughs up blood, it's obviously coming from the lungs. If they're vomiting up blood, it can come from the stomach. And then one of the questions we want to know is is that fresh blood? Is it old blood? Is it very dark blood? Which is less serious, because old dark blood would indicate that there has been a bleed in the stomach, but generally that it's stopped. So this is the thing we need to find out first of all when we get there.
Systolic of 120.
A paramedic in a rapid response vehicle has already arrived.
So have you started on any new medication that might have caused just an irritant to your stomach?
Yes. Azocol.
Yeah.
It's a little sharp scratch come up in your arm, okay? So I'm just going to...
So nice and still, because you're going to feel a little scratch.
Okay.
Peter instinctively thinks that Laurie's problem may be due to an adverse reaction to new medication and agrees he'll be best treated in hospital.
Okay.
Here we go. All right. Right, okay.
Yeah.
His condition could have been relative to the new medication he'd started, and that's one of the things they would look at in hospital to see whether or not the bleeding from the stomach, which is probably an ulcer, is caused or has been caused by the new medication he started. So it would immediately stop the new medication and let's have a look, see if has he got an active bleeding ulcer, or is it just an old ulcer that's no longer bleeding.
For the trip to hospital, Laurie is accompanied by his wife.
Okay, the race is on. You going to get to it? Never mind. If it's that important, they'll ring back.
Laurie's GP has telephoned the hospital and asked if he can go straight into the medical admissions unit, or MAU.
This is almost vital for patients with what we call chronic medical conditions. He did not need to go to the accident emergency department. It wasn't an acute onset, this is a chronic condition and it needed more longer term care. So by bypassing casualty, he would go directly to a bed, directly to a ward and would receive treatment straight away.
Happily, Laurie made a full recovery.
It's a fun career, it's an interesting career, it's an incredibly demanding career, but it is so rewarding. Every day you work for the ambulance service is a different day.
I get so much more out of the ambulance service because you can do so much more for people and people are pleased to see you and it makes you feel good about yourself.